pelvic posse, and welcome to the Empower Your Pelvis Podcast. Hey, everybody, welcome back to another episode of the Empower Your Pelvis Podcast. I'm Dr. Amanda Fisher, and I'm the host of this show, and I'm also the owner of a private practice here in Kansas City, Missouri, one on the Missouri side, one on the Kansas side. I'm also a mom to 3 boys, and I've had 3 C-sections. I wanted to make a point to say that because April is C-section Awareness Month. So if you don't follow me or haven't followed me for a while, you might not know that I myself have had 3 C-sections. Now, I got into pelvic health long before having my C-sections, but after having my first C-section, I started to think, why is nobody talking about how I'm supposed to recover after having this baby with major abdominal surgery? Second baby, I tried for a VBAC. It was what I wanted to do. And then it didn't end up happening. So about a week out from having our second boy, I realized I was having a second C-section. I started diving into research because I knew after my first one, I was having crazy abdominal cramping when anytime my bladder would fill up with fluid and my bladder just wasn't stretching. It was terrible cramping. I went to see a pelvic floor PT. We tried working on scar tissue, which really helped, but nobody talked about it. So I dove deep into the scar tissue and found out how much scar tissue actually adheres from the uterus being cut, then pulling down the bladder to have a baby. And then that bladder kind of comes back up here. And you've got a lot of scarred tissue adhering, decreasing the mobility of the bladder. That bladder, then, if it's decreased mobility as it wants to stretch to fill up with fluid, we can get some cramping. You can get bladder spasms, bladder urgency and frequency kicking in because your body's trying to tell you it needs to go. Because as that bladder is stretching, it gets the sensation that it's full, but really it's just that the scar tissue is holding it back. Okay. That was my second one. After having the second one, I did not want to go through the same bladder sensation issues that I had had. Crazy abdominal cramping, the urgency and frequency. Goodness gracious. Urgency and frequency. So I really got into how to heal into my C-sections after my second. I started going into scar tissue. What I was finding, everything was very superficial, meaning we were only looking at how the skin mobility was looking versus how deep things were going. So healed a little bit differently after my second. I also had some crazy nerve issues after my second baby, after the second C-section. Hypersensitivity. I didn't want to be touched. I had to really work through calming down the nerves that supplied more of my pubic bone, clitoral area, and inner thigh, because I did not want to be touched by my husband. Anytime he came through, I would backslap him, not by wanting to hurt him, but more of a knee-jerk reaction. And I really had to get the tissue to calm down. And then after our third, we ended up with a C-section. We knew we were going to be in the NICU with him, or not in the NICU. We knew he had some heart issues going on. And it was just an easier route to have the caesarean to be ready for that opportunity. And we did end up in the NICU for about 2.5 weeks after his birth. And I had a lot of downtime on my hands because I was in the NICU by myself with the baby. And so I started really working on tissue early on, deep belly breathing to start kicking in my diaphragm with the correct muscles, trying to work abdominal tissue, not scar tissue work. It was way too early for that, but dealing with more of the calming down and helping with inflammatory process. I had compression leggings after my third, which I highly recommend. I actually didn't get them for my second until I was at least 4 or 6 months into my postpartum recovery. And I'm a sucker for compression. So as I mentioned earlier, April is Caesarean Awareness Month. If some of this stuff kind of surprises you or you had no idea that there was even healing after a C-section, there is, because with it being major abdominal surgery, lots of tissue is being worked on you. It goes through 7 different layers to deliver the baby. And I'm going to go through all of that, plus how to heal after a cesarean. Doesn't matter if you are a couple days postpartum or even 20 years plus. We're going to go over how to work on that tissue with helping with bladder discomfort, low back pain because of how that plays into the surgery. And I'll go into further depth with that later. Hip pain that can arise. I mentioned bladder. We're going to have bowel issues, bowel spasms, rectal spasms can be an issue, abdominal cramping, how to work the scar tissue, and then what exercises should we be doing after a C-section to get our abs back. And then the pooch. C-section moms, we all know what the pooch is. We get it. It happens. Things tend to fold over the shelf where that line is, your scar, things fold over the top, and then we start to fill it up even down low. And so I'm going to do a free C-section webinar for anyone who wants to participate. Please click the link below. But this is going to be really to set off our April C-section awareness month correctly. It's going to set it off in the right way so you guys better understand what happened during the C-section, what's going to happen during the C-section. And then there's going to be swag bags going out for people who want to just, have another opportunity later on with cesarean things to use for like exercises and for the postpartum healing. So if you're interested, let me know. You can always find me on Instagram to ask me any questions, especially on Wellness Wednesday, or comment on a cesarean reel that we've got out there. I'm more than happy. This is my jam because I've been there 3 times. I've kind of developed my own cesarean protocol with how we treat these patients, what we need to be doing so we don't miss anything. And because we deserve it. Number one, we had a baby, but it was major abdominal surgery. And back when I was having these, y'all, if you had a C-section, it was like you didn't need to see pelvic floor PT. And that's just a load of crap, in my opinion. So if anything, I think we need it more. Not only do we need to assess the tissue in the abdominal area, but we need to be assessing the pelvic floor too. And a lot of our C-section moms, that pelvic floor just gets looked over and they're not having internal exams looking at how that muscle tissue can play a role in it as well. So if you're interested, sign up for the free webinar. Link is below. Happy C-section Awareness Month. And I'm an open book. So if you've got anything, please let me know. Thank you all for tuning in. Please share this with any C-section moms who might be interested in this free webinar or who just might be interested in the healing process as well. And then as always, happy wellness in your pelvis. Enjoy. And I'll talk to you guys later. Thanks, guys. Hey, Pelvic Posse. I want to thank you so much for joining into this week's episode of the Empower Your Pelvis Podcast. Can I ask you a couple of favors, please? Number 1, can you like and subscribe to this podcast so that you can continue to empower your pelvis forever so that you will never miss out? Number 2, can you leave us a rating and a review telling them how amazing we are and everything that you have learned about your pelvic health? And then number 3, if you haven't seen the video version of this podcast, you can go over to youtube.com/C/Empower Your Pelvis for all your visual learners out there. We have all types of great visuals in there for you to not only listen to, but to also watch. Thank you so much again, and make sure to give your pelvis some love. Until next time, peace out, Pelvic Posse.